Hello, I'm Esther Gido-Yuart. It's Friday, April 7th. This is Africa 54. As we commemorate World Health Day on Friday, Nigerian authorities say the country still has not reached its target COVID-19 vaccination percentage that would enable it to reach herd immunity. World Health Day is a day to raise awareness on health issues that affect people worldwide, but millions of people are not receiving the medical treatment they need. Africa 54's Linord Moudou speaks with the acting director of the Africa CDC. And more than 50 years later, NASA is preparing to return to the moon in 2025. But first, VOA speaks to the crew that will participate in a planned flight around the moon in 2024. Friday, April 7th is World Health Day, and the World Health Organization is observing its 75th birthday. It is also an opportunity to motivate action to tackle the health challenges of today and tomorrow. Over the last several years, nothing has been more of a health challenge than COVID-19. Nigerian authorities say more than 2 years after commencing vaccination for the coronavirus, the country is yet to inoculate up to 70% of its eligible population needed to reach herd immunity. Health experts say hesitancy, funding gaps, and lack of local vaccine production are inhibiting factors. Timothy Obiezu has more from Abuja.
In February 2020, Nigerian authorities announced the country's first case of the coronavirus. It was an Italian citizen from Milan. And by the end of the year, Nigeria had recorded more than 1,000 deaths from over 68,000 cases. But as the virus spread in the country, so did myths and misinformation about it. Alheri Issa says she feared for her family.
Not easy for us. But we manage ourselves, and people, they are bringing something to help us.
About half of Africa's population has been fully vaccinated according to the Africa CDC, but that is still below the World Health Organization's target of 70% by the end of 2022. Nigerian authorities began vaccinations in March 2021 and say myths and misinformation about the virus have been persistent problems.
We are doing a lot of work to mobilize the public to know the importance of vaccination among vulnerable groups, because it's essentially meant to protect individuals.
But experts say inadequate funding and infrastructure to locally manufacture and store vaccines also play a role. In 2021, about 1 million doses of COVID vaccines expired in Nigeria, the highest single number in any country. Last year, Health Ministry announced a deal with Serum Institute of India, the world's largest producer of vaccines, to start local manufacturing of vaccines.
It's obvious now that the will is there, the realization is there, but we still have a lot to do to make it happen. South Africa, for example, was well positioned to produce some of the COVID-19 vaccines, but then there wasn't enough market to sustain that initiative, and it did not go far.
In 2021, African leaders pledged to increase vaccines production to 60% by 2024 to reduce dependence on imported vaccines. But experts say African leaders must integrate routine vaccinations into regular public health plans.
And so we think of vaccinations as programs, as projects. Oh, it's vaccination day. Then a vehicle is driving around. We hire young people, knocking doors. And so vaccination will not work with such sporadic interventions. We have to be more systematic.
Rwanda, Liberia, and Mauritius are among African countries to fully vaccinate 70% of their populations against COVID-19. Timothy Obiezu for VOA News, Abuja, Nigeria.
World Health Day is a day to raise awareness around health issues that affect people worldwide. The WHO says millions of people do not receive the medical treatment and prevention tools they need. Many of them are in low and middle income countries, including Africa. This year's World Health Day focuses on health for all. Africa 54 health correspondent Linord Moudou spoke with Dr. Ahmed Ogwal Ouma, Acting Director of the Africa Centers for Disease Control and Prevention, and asked how Africa CDC is ensuring health for all on the continent.
This World Health Day on the 7th of April, and the theme Health for All is at the core of our work as Africa CDC. We do everything so that everyone is protected from disease threats and health emergencies, meaning we are delivering health for all. We do everything so that the reservoirs of diseases and different pathogens in the animal, the environment are contained before they affect the health of animals or human beings. This is us delivering health for all. Beyond human beings, we are also delivering health for the animal and the environment parts of society. And as Africa CDC, one very core part of our work is to strengthen our health institutions, to strengthen our health workers' capacity, also to ensure that health products are being manufactured on the continent and therefore more easily available. Finally is our convening mandate. We bring together governments, non-governmental institutions. We bring together human health, animal health, and the environment so that we can all be able to work in synergy to deliver health for all.
What does a theme like this mean for that patient, health for all, if that person doesn't really have access?
That is really the majority of the Africans having challenges with access to quality healthcare. Our role as Africa CDC is threefold for somebody like that on the African continent. One is keeping them safer, meaning we want to keep disease away from the communities. And we do that by working with the communities, providing them with the right information, which they then consume within their own contexts and cultures. The second aspect is ensuring that when diseases visit a community, we can be able to identify those diseases quickly and therefore reduce the risks of that disease spreading. In this way, we protect the larger community from the effects of any health emergency or disease threat. The third is we work with our governments to expand the reach of the health system to the communities. This is a task that goes beyond Africa CDC's mandate, and our role is to ensure that governments have the capacity to understand, appreciate, plan for that expansion of the health system so that everybody has access to good quality health. If someone goes to the health facility early, even if it is far, then they get treatment better, faster, and they get healing in a more from a lower level health facility. If they wait and the situation becomes serious, then it means they will need to go even further to seek specialized care. That's why community health workers are a very important tool in ensuring that communities are healthier.
What is the significance of health for all when it comes to vaccination?
Linking vaccination to health for all is that when a population is adequately vaccinated, then they are adequately protected from those diseases. So getting vaccinated is actually contributing to health for all. Second, vaccination is what saves lives, not vaccines. We must ensure that members of the public appreciate and know that it is their role to ensure that vaccination is actually successful. So whenever there is need for vaccination for children, for adults, and for everyone, then we must go and access those vaccines. We need to play our part as members of the public. We get vaccinated, we protect ourselves and those around us, and we are on the road to achieving health for all.
That was Dr. Ahmed Ogwal Ouma, Acting Director of the Africa Centers for Disease Control and Prevention, speaking to Africa 54 health correspondent Linord Moudou. Christian pilgrims and clergy members marched through the ancient stone alleys of Jerusalem's Old City, retracing Jesus' path to crucifixion in the observation of Good Friday. The faithful carried wooden crosses and sang hymns to mark one of Christianity's most solemn and sacred days. Worshippers from around the world once again marched slowly along Via the Dolorosa, the cobblestone path that cuts through the old city where tradition says Jesus bore the cross to his crucifixion. The pilgrims stopped at several points on the way, reenacting symbolic moments from Jesus' story. The procession culminates at the Church of the Holy Sepulchre, where Catholic and Orthodox Christians believe Jesus was buried before his resurrection on what is celebrated as Easter Sunday. Now to Zimbabwe, where the government has started 2 weeks of nationwide consultations on whether to abolish capital punishment for people convicted of premeditated murder. Columbus Mavunga reports.
Zimbabwe's government says it has signed a number of international treaties which require it to ask citizens if they still want capital punishment as a possible sentence for people convicted of murder or treason.
So we want to hear the voice of the people, want to hear their opinions, their views with regards to the death penalty. What really is the position of the people of Zimbabwe?
It appears Zimbabweans have a wide range of views based on public hearings.
What is important is to prevent a person convicted of murder from rejoining his community, not to hang him. Just give him a sentence that will not allow him back to normal life.
39-year-old Godfrey Chikwezero disagrees.
If someone kills someone, he must be hanged. We have had so many cases of murderers leaving jail and coming back into the community to commit the same crime.
Zimbabwe has not executed a death row inmate since 2005. President Emmerson Mnangagwa has indicated that he is against the penalty. Roslina Muzerengi, a campaign coordinator at Amnesty International in Zimbabwe, hopes the current hearings will lead to the abolition of capital punishment. But she says the public needs more time to debate such a contentious issue.
And it would have been prudent if enough time had been given before the public hearings to enable communities to better understand the reasons why we are saying that the death penalty should be removed from our statutes.
Once the consultations are over, President Mnangagwa is expected to decide whether the country holds a public referendum on the issue or simply keep the death penalty on the books. Columbus Mavunga for VOA News, Karoi, Zimbabwe.
A Ugandan minister is being charged with multiple corruption offenses related to allegations of diverting metal roofing sheets intended for residents in the troubled northeastern region of Karamoja. VOA's Paul Ndiho has more.
Uganda's performance on Transparency International's 2022 Corruption Perception Index was disappointing. Among the 180 countries ranked by score, Uganda placed 142nd. This low ranking reflects a perception of widespread corruption in the country's public sector, placing Uganda among the countries with the highest perceived levels of corruption. Kampala's anti-corruption court says Karamoja Affairs Minister Mary Goretti Kitutu is being charged with corruption offenses, including the loss of public property and conspiracy to defraud.
Not at all. This is not selective prosecution. What has happened is that the case is being handled in piecemeal. So this is just the first case file. So there's a case file in respect of each suspect, and the case files will be submitted by the police to the office of the DPP for consideration.
The Karamoja region is located in a remote area bordering Kenya and South Sudan. It's home to vulnerable pastoral nomads who often face droughts and cattle raids. The charge sheets allege that Kitutu caused the loss of over 14,000 iron roofing sheets by diverting them for her benefit and that of third parties, knowing it would result in the loss of public property. Kitutu pleaded not guilty to all charges.
So the Honorable Minister has applied for bail today, and the court is yet to consider the application. The case has been adjourned to next week for ruling.
And was remanded, with a court appearance scheduled on April 12. In February, 3 close relatives of Kitutu were arrested for selling metal roofing sheets branded with the Office of the Prime Minister, according to a report in the government-owned New Vision newspaper. The Voice of America tried to reach out to Kitutu or her representatives for a comment, but all attempts went unanswered. However, in a previous appearance before a parliamentary committee last month, she asked for forgiveness for mismanagement in the distribution of metal roofing sheets. Paul Ndiho, VOA News, Washington.
April 7th, 2023 marks 29 years since the Rwanda genocide, when more than 1 million Tutsis and moderate Hutus were exterminated during a 3-month period. This year's theme is Remember, Unite, Renew, or Kwibuka in Kenya-Rwanda language. The annual commemoration pays tribute to those who lost their lives through the heinous killings in Rwanda in 1994. Among the places where commemorations are being held is Rwanda, the East African Community headquarters in Arusha, Tanzania, as well as the African Union headquarters in Addis Ababa, Ethiopia. For more on how the annual Kwibuka events are being observed here in Washington and around the world, I'm joined live via Skype by Tim Ishimwe, a VOA Central Africa reporter who is downtown at the National Press Club. Hello, Tim.
Hello, Esther.
Brief us on how the panelists are, commemorating this day downtown DC.
Oh, thank you, Esther. Here at the National Press Club, as elsewhere in the world where Rwanda is represented, today, 29th commemoration of 1994 genocide. So there were a lot of people who came from different states in the gathering here in Washington, D.C. To remember the loved ones who lost their lives during the genocide. There were almost like maybe 200 people who traveled from different states.
Tim, have you been able to speak to any survivor of the genocide who probably attended, the event where you're at? And what are they saying?
Yes, I did. I spoke to Console Nishimwe. She's from New York City. She gave her testimony. She told me how she survived the killings that took almost 1 million people in Rwanda, where her father and the 3 siblings were killed. And she also taught me how she overcame this atrocity, where she actually eventually put that into writing. She is an author of the book called Tested to the Limit.
Tim, I know you've been covering this also from Rwanda, on the phone and on Skype as well. What is the common theme that you hear from Rwandans as they commemorate this day? What's different this year?
Well, I thought there's no quite different. As people went through some, it's being commemorated the same way as here, same as in. People are just remembering the lives of their loved ones who were killed during the genocide. So there's no quite big difference that I can tell you now.
Tim, thank you very much for your reporting. Tim Ishimwe is a VOA Central Africa reporter. And still to come, NASA prepares to return to the moon in 2025 after 50 years. We'll be right back. In other news, a military tribunal in the Democratic Republic of Congo on Friday sentenced 6 men accused of murdering Luca Attanasio, Italy's ambassador to the DRC in 2021, to life in prison. The ambassador was among 3 people killed on February 22, 2021, when a United Nations convoy was ambushed in Congo's troubled east. The Ethiopian government of Prime Minister Abiy Ahmed is dismantling regional forces, aiming to integrate them into the federal army, police or civilian life, according to a government spokeswoman. Selamawit Kassa told the media Friday, quote, special forces members in the entirety of Ethiopia will be reorganized with their choices fully guaranteed and their desires respected. And the World Bank says it has approved a grant of $150 million to help Chad reduce the risks of flooding and strengthen its urban planning. The World Bank Country Director for Chad says the long-term vision of this project is to transform N'Djamena, Chad's capital city, into a more resilient, green and sustainable city. The last time humans were on the moon was in 1972. Now, more than 50 years later, NASA is preparing to set foot back on the moon in 2025 if all goes as scheduled. VOA's Alexander Krugyalakov spoke with the crew that will take part in the first of those missions, a planned flight around the moon in November 2024.
Congratulations to everybody, of course. Happy to be here with you with this incredible team. I'm recalling our movie about Apollo 11, and the colleagues of the crew called them friendly strangers, which means that they came together by some accident or reshuffle or swap between crews. And they were not really friends, but they perfectly worked together. Who are you to each other?
Friends.
Yeah, we've worked together quite a while now, and we're not strangers at all. A lot of trust has already been developed amongst this crew. We're just getting started.
You've had experience with many hardware, like from shuttle to Soyuz and Crew Dragon. Have you already started new training, and how is it different?
No, we start training in June. The actual training will start in June.
But just being astronauts here, working at the Johnson Space Center, we at least have a basic understanding of Space Launch System, Orion spacecraft, the European Service Module. So we know the fundamental hardware, but we haven't started training. We don't know the innards of the machine yet.
Any big competition in the future, and from what side? From private companies, from other nations? What do you think?
When I think about how we cooperate with both other nations and companies, the word competition doesn't come to mind, but the word cooperation does. One of NASA's missions, stated missions, is actually enabling a space economy. And every time we do something, we enable a market, we create a market. Every time we take something that has never been done before and show that it is not only doable, but that there could be a market around it, that is a success for NASA.
I believe this is Colonel Hatfield in his Facebook said, what a crew, but what a danger, something like that. Do you feel that it might be dangerous, or it's just within normal margin of any flight?
Every mission is dangerous. That's a part of the risk, but NASA has a great process, and our industry and international partners have great processes for analyzing that risk, understanding it, and then making risk-informed decisions. And so, yes, we've got training, we've got evaluations to do, but we've got this amazing team that we're going to be working with, and when they're ready, and when our training is ready, and when the vehicles are ready, we'll go.
That was VOA Russian reporter Alexander Krugyalakov with that interview. And now for our entertainment report featuring Heather Maxwell, host and producer of Music Time in Africa. Hello, Heather.
Hi, Esther. Yes, starting out with some disappointing news. Stromae has canceled all future concerts until the end of May. The Belgian singer-songwriter and rapper Paul van Haver, better known as Stromae, who was on tour in Europe promoting his last album Multitude, says the cancellation is due to health reasons. Stromae recorded record-breaking albums in 2010 and 2013, and then he largely withdrew from the public eye for 8 years due to depression, burnout, and negative side effects of an anti-malarial drug. Stromae triumphantly returned, though, in 2022 with songs like L'Enfer, Santé, and Fils de Joie from his new album. In a statement to his fans published on social media, Stromae says, quote, "I've come to the realization that my current health state does not allow me to come and meet all of you at the moment. I regretfully share this news with you, which fills me with sadness, but I have to admit my limits." He also says that he has to take the time to get better in order to resume performing. Writer note, South African musicians Lorraine Klassen and Mongezi Ntaka released a new album called Ukubonga Gratitude in November. They interpret a collection of songs written by some of Southern Africa's greatest celebrated singers and composers. Now, I won't tell you too much more about that because Mongezi is back from South Africa and he's based here in Washington, D.C. and will be our guest next week on Africa 54 with his guitar in hand. And finally, Mukumba makes a comeback. The international award-winning band from Victoria Falls, Zimbabwe, Mukumba announces its comeback on the world stage with Nzara Hapana, the first single from its forthcoming album Tusona. I spoke with Marcus Gora, the band's longtime manager, on Thursday, and he says they're excited to release the album after having worked on it throughout the pandemic. It drops July 7th. And also, they have returned to performing again in Zimbabwe, and they can't wait to start their first international tour since the pandemic, beginning with Eswatini at the MTN Bushfire Festival, end of May, and then again in Europe in June. And that's it for this week's Entertainment Report. For more details on this and more music, check out my radio show, Music Time in Africa, online at voaafrica.com or live on shortwave and select local FM stations Saturday and Sunday. Esther, back to you.
Thank you so much, Heather. Be sure to join Heather Maxwell's Entertainment Reports every Friday right here on Africa 54. And that's our show for today. Be sure to watch Africa 54 on our website at voaafrica.com. From all of us here in Washington, have a great weekend.